Andy Minko na Minko. Okay. Welcome, ladies and gentlemen, across the globe. This is Dr. K Four Stars Radio, Atlanta, Georgia, USA. Four Stars Radio and TV. Anytime you see me here, you know we have some really, really good information. We say education, information, entertainment, and empowerment. And we're going to have some great, great, great discussions today. To I would say, Force Us Radio, we give it back to our community in any shape or form. And we're going to have more discussions for our lives and how we live a life to the fullest. But this time, we're going to talk about something special. And it's really, really special. When we talk about men's sexual health. It's a no-go area at all. So I want everybody, get your pen and a pad ready as we're going to talk to somebody who's also special on that field. So uh, as I'm talking right now, I'm going to bring my guest today is Dr. Vincentia Adjei. Welcome, doctor. Welcome.
Thank you, Daddy. Thanks so much for having me.
I always say, I'm always excited about that when I hear you and I hear other colleagues who are doing these great things, to, especially when we talk about our men. This is especially on your field of expertise. When we talk about men's sexual health, then it's a no-go area at all. You don't want to see it, and
Absolutely.
we, especially we
Absolutely.
the guys, we shy too much. Now, tell us about when we talk about men's sexual health. What do we mean? What does it mean in the first place to begin with?
So basically, when we talk about sexual health in general, it is actually exploring the health of an individual's reproductive and sexual well being during any stages of life. So there are various topics when it's very broad. But today, I just want to talk about erectile dysfunction, prevention,
Mhm.
treatment, and also testosterone, which is the main dominant hormone in men. So,
Okay.
just like you said, when it comes to sexual health, it's a no go. Absolutely. It's a very sensitive topic that most men find it very uneasy to talk about. But to me, if you are able to talk to your provider about a headache, talk to them about high blood pressure, cholesterol, or any pain, why can't you talk about your sexual health?
Okay.
So we just want to enlighten people that it is actually causing a whole lot of issues. So people should be open to talk about the issues that they are having.
So it's a broad topic. Now let's
It's,
begin
it's a
with the ED, what we say erectile dysfunction. Let's begin with that.
okay. So
The
whenever we
causes
talk
and effect.
about, that's right, whenever we talk about erectile dysfunction, that is the inability to get and keep an erection firm enough for any sexual activity. Okay, so do you know that about 52% of men experience some form of erectile dysfunction in the United States? And also having any sexual intercourse without a full erection. When I mean a full erection, I mean 100%. So there are ways of measuring degrees of erection. When it's 100%, there shouldn't be any bends or kink. It should be absolutely straight. That is 100% erection. So without having an intercourse without a full erection can actually end up in erectile dysfunction. Why am I saying that? When the erections are not full enough and you engage in any activity, you cause more bends or kinks in that muscle because, mind you, the penis is a muscle. So anything that can contribute to a bend or a kink can definitely gradually end up in erectile dysfunction. And also, 20% of men with erectile dysfunction have complete dysfunction. That's whereby the muscle is completely flaccid. While 80% of the time, erectile dysfunction could be mild or moderate. So when we talk about the causes of it, vascular disease is the most common cause of erectile dysfunction. So when it comes to erection, it's all about blood flow to the area. So anything that can potentially block or impede that flow of blood will result in erectile dysfunction. So let's take a look at diabetes. I don't want to go into the whole physiological part of diabetes, but we know that it's a vascular disease. And if you do have that, it can mess up with your nerves. And when nerves are actually messed up, it can also impede on what? Your blood flow. So diabetes is number one cause. When we talk about obesity, that can also what contribute to erectile dysfunction. How about high blood pressure? Hypertension can also what contribute to erectile dysfunction. High cholesterol. So anything pertaining to your vascular system can what result in erectile dysfunction. When you do have prostate issues, that can also what result in erectile dysfunction. And of course, normal aging can also result in erectile dysfunction. So this might be, I'm very sorry, but it might be a little graphic. This is just how the inside of the penis look like. So the penis is actually filled with a spongy area, whereby we call it the corpus cavernosum, which is filled with a bunch of small blood vessels. So if you can see, there are teeny bitty blood vessels, which allows the sponge-like tissue in the penis to fill with blood during an erection. So, however, these small, teeny blood vessels can become damaged or blocked over time due to the underlying conditions that I had previously mentioned.
Okay.
So, these damaged blood vessels may have a more difficult time opening and closing, which allows blood to flow in and out of the penile muscle to produce an erection. Do you have any question before I continue?
I was going to ask the causes and then the effect, and I think you were already explaining that. But yeah, because what actually causes it? Because you've made us know certain things. You made mention of cholesterol, whatever it is. At what point that will affect you, and what you have to, what are some of the precautions you have to take before any of these things will actually happen to? Maybe people have been doing whatever they want to do, they still have it. So I wanted to elaborate a little bit on that for me.
So when it comes to the blockage, it can actually build up over time. It doesn't take just one incident for it to happen. For instance, somebody with a high blood pressure, it just doesn't happen over time. It just it's like a stage, okay? It goes from abnormal, elevated, and then a stage one, a stage two, a stage three. So same as with erectile dysfunction. So sometimes having performance anxiety could even be classified as a form of erectile dysfunction, meaning maybe you and your partner decide to do something, right? But then at that moment, your erection might not be strong enough even for penetration, or it might not be strong enough for any activity at all. When that happens, it kind of causes stress. And then you might not even want to what try and engage in that activity anymore. And this can actually put a strain on your relationship. And according to research, ED actually increases depression by 192%. So this is how serious this issue is. And only about 75% of men who experience ED actually don't even seek any treatment. So let's say about 25% only seek treatment from their providers, but about 75% of them with these issues don't even seek any treatment. So there are a whole lot of men who are around having this issue and not having it addressed.
Okay. Okay. All right. As you've made mention of all this issue, what are some of okay, all right. Um, we uh, we are talking about the men's health and men's sexual health with Dr. Vincentia Adjei. And if you listen to it, I want you to take your pen and pad so you can write some of this information out. She's going to put some of this information for you to get in touch or get in contact. So if you are going through anything of this man's sexual health, you can also reach out for her because these some of these things sometimes it comes natural, and then from our negligence, we do certain things that always gets us into this kind of trouble. So, Doc, let's talk about. I know all these things. I'm not too familiar with the medical health, but I can talk about some few things that I know from approaching some of you doctors when I go to visit myself. How does prostate also affect this ED we're talking about?
All right. So, when it comes to the prostate, looking at the anatomy of the male reproductive system, the bladder is actually what enclosed by the prostate. Or whenever we do a digital rectal exam, we should be able to feel the prostate, which is very rubbery. It should feel very smooth. Well, age can be a contributing factor of enlargement or risk factor. If you have a family history of any prostate issue, there is a possibility that you might also would have some prostate issues. So whenever the prostate gets enlarged, it pushes on your bladder. And most men don't have UTIs. Females are very prone to having UTIs. So men usually have, whenever you start having issues like frequency in urination, urgency with urination, inability to empty your bladder completely, decrease in the stream of your urine, that should tell you there is some prostate issues going on. And this prostate can also push on your urethra. So when that happens, since everything is kind of connected, it can impede what or have an effect on your erection. So most of the time when I see my patient, I ask them, how strong is the stream of your urine? So if the urine strength is not that strong, that can also depict that there is some what ED or erectile dysfunction going on. That means there is some issues going on what with the prostate.
Oh, okay. This is we finding some few difficulties here, but my technician is making sure we got it and we got it right. So I will be right back with you. This is Data K from Four Stars Radio. Stay right here. I'll be right back with you. Welcome back, ladies and gentlemen. Welcome back, everybody around the globe. Then set up right. This is a very good information we all need as we aged up. Not even aging up, but it is how we have to recognize and how we can approach situations where we find it very difficult in talking to most of the time even our own PCPs. And so we've had Dr. Who's specialty is right on the men's sexual health, who's elaborating all these informations to us. So just pay attention and then listen to who was finding out the prostate. Is it something that a prostate can also constitute how men's sexual health fall apart? Talk to Dr. Vincentia Adjei. Doctor, welcome back.
Thank you, Daddy.
Okay, so you were talking about this, the prostate, how the prostate can affect in some shape or form. So continue from where you left off.
Okay, so and when it's painful, definitely it is going to interfere with the pleasure.
The testosterone too, can the testosterone also be a contributing factor? And
And just finish on the erectile dysfunction part, talk
okay,
about prevention, talk about treatment, and then we can jump on the T, the testosterone part, which is the hormone. Definitely, that also can contribute to some form of erection. This one is all about blood flow to the
okay,
penile muscle.
okay. Give us know. Can we resuscitate it in order to have your sexual health as it was before?
Absolutely. Whatever functionality you have at this point, that it doesn't actually proceed to any complications or any tertiary issues that you might have. So when it comes to ED prevention, making sure that if you have any underlying conditions such as high blood pressure, I know most men, and mostly when I talk to my patients, the one with high blood pressure, they don't want to take their medications, all because the medication can what relaxes the muscle, which can also contribute to first. It's all about your heart. So we have to make sure your provider, let's try and treat it for you. And even the medication that you are on work well with. So high blood pressure, cholesterol is another one. Diabetes is another 1 milligrams. Than that, it helps with cardio if you are going to be doing weightlifting, strengthening of the muscle exercise, and taking this daily. That helps you a lot. So that eliminates you from taking any pre-workout supplement that might have undisclosed ingredient that could be.
Like a doctor might. That is why they find it reluctant to take those medications because it doesn't work. Now, what about this tability you're talking about right now? Is this something that can bring a lot of benefit, or using it for the long?
Hasn't been, of course, any research about long-term use of it, but it works for a greater amount of people having erectile dysfunction. And it's not just the tadalafil, so it's just like an adjunct blood pressure or 5 for daily use, because we want that constant blood flow to the penile muscle. So we are trying to preserve the functionality of it and also make it better. Secondly, I will also prescribe a 20 milligrams, which can be used as needed. So the 20 pump is.
Since this be the first time, what did you want to? What are some of your information? We need your information. How we can reach
That's
out to you.
right.
We need
Yeah. So
information
my
how we can reach out to you in order for us to start the pre-treatment before it get worse.
That's right. So my phone, the office phone number is 470-560-7449.
So
And
four
we
seven
also do.
zero five
Mhm.
six zero seven four
That's right.
four nine.
That's
Okay.
right.
All right. Okay.
And also,
Uh-huh.
we have a website. If
Mm-hmm.
somebody wants to look us up and call, it's www.vinismedical.
So yeah, I can. Yeah. So your last word for today to let the people know that this is very essential because we will come back with the testosterone and then some of the therapies you have to go because I read a little bit about it and with your knowledge and what you practice every day, you can throw some light on it. But for right now, we're going to end up here. But I want you to say the last word and tell my brothers who are going through such a thing what they had to do from the beginning in order for them to not to be late in the treatment process.
All right. So I would say that I would encourage every man who is experiencing any form of erectile dysfunction to feel comfortable to talk about it. Because if you don't seek early treatment, going to be a little tougher to treat on your health as well.
Okay, all right, all right, all right. Ladies and gentlemen, thank you all for taking the time to listen to the program. Don't hesitate to call Dr. V or Dr. Vincentia at 470-560-7449. 470-560. Find out from Dr. V.
Send us a message through the website or also send it as a text message. We'll do our best to respond to you in a timely manner. And you can also call and leave a message, and we'll definitely reach out to you. But I just want to end that we also have virtual visits, so you don't have to travel. We do have telehealth, whereby it's just like a video, so it has that person touch to it that we can discuss your issues and come up with a plan or come up with any recommendations that is going to help you. So Monday to Fridays, 9 a.m. to 4 p.m.
Okay. Thank you, Dr. V. Thank you very much for stopping by. I know this is not the first time. We are going to do it. We're going to continue to do it because men's health is very, very crucial. It's very important. And we are so appreciative of your help in the community and the entire world, especially we, the men. So we will come back again and talk about the testosterone and then other therapies we have to go because we want to keep the
That's right.
okay. So thank this is dedicated 4 Stars Radio TV, Atlanta, Georgia, USA. Information is secretive. So thank you for taking the time and dedicate. We're done for right now. We will come back and go to our local for the race of our weekly program that we do, making sure that our country Ghana is safe and everybody out.